Alexandra Lebenthal is somebody that I want all of you to meet here on America Tonight, because she suffered from something that, coincidentally, a friend of mine also had the same thing happen to her, where, can you imagine this? You're drinking a cup of coffee, you're doing something simple as trying to write out, let's say, a note, and your hands shake, and they keep shaking, and what are you thinking? Trying to figure out, well, what's going on with this? What do I possibly have? And apparently this condition, and some of you may have it that are listening, is called essential tremor. And again, imagine you're going along, one day you're fine, and all of a sudden you can barely bring a cup of coffee up to your own mouth. Alexandra, thanks so much for coming on America Tonight for this edition of For Your Health. And take us back to what happened to you and what that felt like going through that moment.
So I've had essential tremor since I was 3 years old. So it's something that I've always lived with and has been frustrating and embarrassing and has prevented me from doing really basic things like holding a cup of coffee with one hand. And so when I went through this procedure to correct it, it was just life-changing. It's like I have a new hand, like I'm the bionic woman or something, and I keep staring at my hand, and it doesn't move, and I can pour milk in my coffee and drink with one hand, and take a picture with my iPhone without it being completely blurry. So it's just miraculous.
Yeah, and we will tell. I want to tell people that, listen, when we talk about finances, you're the CEO of a wealth management firm, and you're considered, a lot of people have dubbed you one of the more powerful women on Wall Street, certainly on a top 10 list, top 5 list, whatever. So how tough was that? How did you kind of cover that up? Or no, you didn't. You just tried to do what you could as you were going along doing your thing.
It's, sometimes, very, very rarely, I would tell people. But a lot of the times, I do my best to hold my hands under the desk during meetings. And sometimes I wouldn't even think it was that noticeable. And I actually work with my brother, and people would ask him after, is your sister okay? So people were noticing. And, there are two issues with that being in the financial services business. One is people think, is she really ill? Does she have Parkinson's? Is this something we should worry about in terms of doing business with her? And the other is, at least from my perspective, people might think, why is she so nervous? Is there something, that she's hiding? So it really has been an issue for me, it being in the industry that I'm in.
So that's great that your brother was there to help you, but I can imagine exactly what are people thinking. So you have this procedure, and it's called high-intensity focused ultrasound.
Right.
Tell us what that is.
So the great thing is that it's non-invasive. So for a lot of people, it truly is an incredible way to fix this. What they do is they basically put this metal frame on your head, through which they target essentially 1,000 ultrasound beams, which in and of themselves, each one would not be dangerous, but targeted like that, they basically go to the point in the brain that causes the tremor and pretty much zap those cells and kill them through a series. They do a series of these the focused ultrasound beams, and you're awake during it, which is kind of crazy, because they need to, each time they do it, then they need to have you draw a spiral, improving, because if you have tremor, drawing a spiral or a straight line is just impossible.
Yeah. How did you find out about this? I mean, all these years in between, I'm sure going to doctors. How did you meet the doctor ultimately that showed you this procedure and did it?
Well, I have been a patient of the neurology department at Weill Cornell for a number of years, and I've taken some medications that really didn't work for me. And there is an invasive procedure called deep brain stimulation, where they actually drill into your skull. And I had looked into that, and that was just a little bit more than I wanted to do. And then, this is crazy, I was on Facebook one day, and I saw a story of the procedure being done in Israel, because that's where it was originally developed, called my neurologist, and he said, yeah, we're getting this at Weill Cornell. And so it was just so fortuitous that they were the only hospital in the tri-state region that was getting, was going to be able to do this.
Wow, that is fortuitous that happened. And what would you tell, because we know I guarantee there's somebody listening to me right now that is kind of suffering through that same thing, trying to figure it out, people wondering if they're ill, if they have Parkinson's, like you said. What would you tell them about what it's done for you? You mentioned it in the top of how different it is. It certainly is a game changer, isn't it?
It is, and you mentioned your friend who's had it,
yes.
And what has been incredible as I have spoken about this or posted on LinkedIn or Facebook or what have you, is how many people have said, I have it, my relatives have it, my friend has it. And so there are 10 million people in the United States that suffer from this. So for anybody who is interested, you can contact Dr. Caplet, Mike Caplet, at Weill Cornell, or you can go to their website, which is Weill Cornell Brain and Spine.org/ET, and find out more about it, because there is, it goes into great detail, and to be able to, for everybody, go through what I have now gone through, this transformation of just picking things up, or even, and this is kind of funny, it was impossible for me to hold a wine glass without holding the bottom of the glass as well. So, and funnily enough, wine does actually make the tremor subside. So I would have to get to a restaurant early if I was meeting somebody for business and down a half a glass of wine first. And you know what, here, this is crazy, being able to toast somebody at a dinner and not have my hand shake. So it's it's these little things that you just marvel at, because I haven't been able to do them for 50 years. Not that I was drinking wine when I was 3, but other things.
Wow. So this is like a whole new lease on life, because look at you don't have to worry about the cover-ups. You can get to the restaurant at the same time as everybody else now.
Yes, and I would tell you the funny thing also is that I was always embarrassed to talk about it and tell people that I had it. I still have never quite put my finger on it. And now, talking to you on the radio, but I'm just singing from the rooftops to everybody. So it's really just, it's been great to talk about it. And again, because there's so many people that are affected, to know that people are hearing about it, and that, they can now have results that will really stick.
Yeah, I love it. What a great story. Alexandra, thanks so much for joining us on ATN. I think this is incredible information, and I know there are people listening to us in the tri-state area, so definitely reach out, because there's a way to solve this dilemma. Thanks.
My pleasure. Thank you.
All right, so pretty incredible, I think, Alexandra's story, and the fact that, as she said, she had this her whole life. I mean, I think the description of going to the restaurant, here she's this powerful woman on Wall Street, going to the restaurant early to down some wine first, because whatever it did, dulling that, and putting it in the, so that would happen. Because you see someone's hands shake, and she's right. What are you thinking? Parkinson's, some other kind of neurological disorder that could be a really serious one, and if you're doing business, that would have to, set off alarm bells, I would think. And the fact that, as she mentioned, geez, what was the alternative? Having your head drilled, that's pretty frightening. So this essential tremor, it's interesting. I have seen this with other people too. So I don't know if that's what it is. Probably I've got another friend that's got that same kind of issue, and it may be that she has that as well. And I think they've tried different drugs and whatnot, and pretty amazing. I think that's just such an incredible game changer when you can drink coffee normally, when you can, and I don't blame her. You're embarrassed to talk about it with people. I would have been the same way if I had that, because you don't want that to be the topic of conversation, and then it becomes this health thing, and what does that mean? And especially in a business circle. So I just think this is such a fascinating story. And then look what the solution is. You're not, She didn't have to go to the extreme of having some kind of surgery. Instead, it's something completely different. Wow, mind-blowing. All right, hang with us. Much more coming your way on the flip side.